Dementia is a chronic and progressive syndrome that is caused by many disorders.
Alzheimer's disease is the most common.
Symptoms of dementia vary between people and everyone is unique.
Areas affected by dementia include memory, judgment, personality, and orientation.
Some people with dementia also experience hallucinations and changes in their behavior.
Dementia is associated with increasing age, but importantly, it is not a normal part of aging.
Older adults with dementia often have other diseases and impairments that increase their need for support in daily life.
This support is usually provided by family and friends.
These family and friends, known as carers, are essential to the support of people living with dementia.
People living with dementia can experience greater difficulties than their level of impairment warrants because of disabling environments.
This is especially true when people living with dementia require care in an acute care setting, like a hospital.
Hospitals were never designed for people living with dementia.
Emergency rooms and hospital wards are busy, noisy, congested places that can overwhelm anyone, but are particularly disabling for people living with dementia.
Moreover, healthcare professionals often lack the necessary education and understanding needed to provide safe and effective care that people living with dementia and their carers require.
The best way to understand the challenges experienced by people with dementia in acute care is to hear directly from them and their carers.
I never met the doctor that was supposed to be looking after him. The nurses wouldn't tell me a lot. I wasn't happy with it, but he was being looked after, and that was the most important thing to me, is he needed transfusions and all this stuff. When I came in and wanted to know something, I didn't feel that they really took the time to tell me anything, or, no, he's had a good night, or he had a bad night, or, that kind of stuff. But I just thought there was lack of communication. When I'd go up there, I'd want some information, and I didn't get it, He's doing fine or something like that. I wanted to know exactly. And one day when I was up there, he got really agitated, and he was in a wheelchair. And I had told him when I was leaving that he was trying to get out of it. And would somebody go in and see him? Not too long after I got home, I got a phone call as he tried to get out and he fell. So, that was upsetting.
Some staff were very good with him. I think they were doing their best, but it was just, he got moved several times in that 8-week period. And that's hugely, hugely difficult for someone in his frame of mind and his deteriorating health. Mm-hmm. And he became quite a different person sometimes. That's a real problem, I think, in our healthcare region here, is just shifting these people around because they need a bed for somebody else, or he was initially on a surgery ward, and then they decided, well, we can't operate on him, he's too old, he's not going to survive, so we're going to move him to this hospital and this transitional unit until we can find a bed from in a nursing home. And that's a real issue in acute care. That's a really big issue and something that needs to be addressed.
Participants emphasize the numerous drawbacks of environments in acute care settings.
It's hard being in a hospital to begin with, but when you're on a ward with 7 or 8 other people, I find that uncomfortable, and because everybody has their own issues, and it's very hard to just relax and sleep or do anything because there's always others around. Constant visitors, people talking loud when you're just having a nap, and then more visitors come in, and I find it stressful. I find the lighting very disruptive. I don't like these fluorescent type lights. They're just bothersome.
I would really love to see the hospitals try to accommodate people with dementia and Alzheimer's, and giving them a space that's quiet and just taking a more careful approach.
One of the ways to improve care offered to people living with dementia is to provide advanced education to healthcare professionals.
Equipped with better understanding, professionals like nurses, social workers, and physical therapists can make a difference in the care people living with dementia receive when they are in hospital.
This has the potential to reduce the length of stay in hospital, decrease the development of a delirium, maintain previous level of functioning, and enable people with dementia to return to their own home.
That really does go a long way.
Oh, for sure.
When you're seeing the same people and they know you and you have a sense that they know you and there's a
They're doing
connection.
something for you.
I think connection is really, really important.
Simple actions such as printing off health records and health information for persons with dementia and their carers has a huge impact.
Actually giving documents, I suppose, or a note or something saying this is what we've discussed, and so it doesn't just go in one ear and out the other, because I have a hard time retaining some things sometimes. I can read it 10 times if I want. And then
The Scottish Dementia Champions Programme educates healthcare professionals to be change agents in their workplaces. It empowers them to champion the much-needed support and care that people affected by dementia deserve.
We are fortunate to partner with Scottish colleagues to adapt this successful program to our Canadian policy, practice, and education context.
A Canadian version of the Dementia Champions Programme can begin to address the improvement to care that people living with dementia and their carers receive in hospitals. For the next 2 days, local, national, and international experts come together to begin this important work.
Thank you to our generous experts.